Welcome to aminacademy.com. In questions how, why, and what. In that, we'll discuss about what are the implantable hearing aids, how do they work. Hearing loss is one of the most common disabilities worldwide. Implantable hearing devices offer exciting development in treating hearing loss in patients who previously had poor treatment options, including those with anatomic abnormalities, chronic draining ears to serve to severe to profound sensory neutral hearing loss. Example of these new hearing technologies include bone anchored hearing devices and implantable middle ear devices that offer hearing rehabilitation for conductive or mixed hearing loss and single sided deafness. Cochlear implant also offer hearing options for patients with severe to profound sensorineural neural hearing loss. Many causes of hearing loss exist, but it is generally increasing with aging population. As a result, it is important to help those with hearing loss functions in their environment. Hearing rehabilitation is most commonly achieved with traditional hearing aid amplification, utilizing devices that sit within the ear canal and over the helix. However, under certain circumstances, treatment options for hearing loss includes implantable hearing devices such as bone conducting hearing prosthesis, prosthesis, middle ear implantable hearing prosthesis, cochlear implant, and auditory brain system implants. Now we'll discuss further detail about this implantable hearing aids. Implantable hearing aids, also known as hearing implants, are surgically implanted devices that bypass damaged parts of ear to restore or improve hearing and include cochlear implants, bone anchored hearing aids, and middle ear implant. Cochlear implants are small, complex electronic devices that provides a sense of sound to individuals with severe to profound hearing loss, especially those who don't benefit from traditional hearing aids. How they work? They bypass the damaged parts of the inner ear, cochlea, and directly stimulate the auditory nerve, allowing the brain to interpret sounds. Components: external part, the microphone, speech processor, and transmitter that are on behind the ear. Internal part, the receiver, stimulator implanted under the skin, and an electrode array that is inserted into cochlea. Benefits: can help individuals understand speech and hear sound better, improving communication and quality of life. People with severe to profound senso- sensorineural hearing loss who do not benefit from traditional hearing aids. Bone anchored hearing aids, BAHAs. BAHAs are surgically implanted devices that transmit sound vibrations directly to the inner ear through the skull, bypassing the outer and middle ear. A small titanium implant is surgically placed in the bone behind the ear, and then a sound processor is attached to the implant. Surgically placed in the bone, processor won't externally and connect to the implant. The benefits can be good options for individuals with conductive or mixed hearing loss or those who cannot wear traditionally hearing aids. The people with hearing loss caused by problems in the outer and middle ear are those who cannot wear traditionally hearing aids. Next one, middle ear plants. Ear implants. Middle ear implant are newer devices that transmit sound vibration directly to the inner ear through the middle ear, bypassing the outer ear canal. They use surgical implanted devices to transmit mechanical energy from the middle ear to the inner ear fluids. What are the components in that? Surgically placed in the middle ear implant and external components. Some devices have an external component that connects to the implant. What are the benefits? Can be good option for individuals with moderate to severe hearing loss who cannot wear traditionally hearing aids or benefit from other implantable devices. Who will benefit? People with moderate and severe hearing loss who do not benefit from traditionally hearing aids or other implantable devices. Implanted hearing aids or cochlear implants bypass damaged part of the inner ear and directly stimulate the auditory nerve, sending the signals to the brain for sound perception. Directly it's do. External sound processor, a microphone and speech processor outside the ear capture sounds and convert them into electrical signals. The internal receiver, a surgically implanted receiver, stimulate under the skin behind the ear, receives the coded signals from the external processor. Electrode array. The thin wire with tiny electrodes is placed in the cochlea, inner ear, which stimulate the auditory nerve. What are the auditory nerve? The stimulated auditory nerve sends signals to the brain which interprets them as sounds. Difference from the hearing aids. Hearing aids amplify sounds and send them through the damaged ear. Cochlear implant bypass the damaged parts of the ear and directly stimulate the auditory nerve. These are the difference between normal hearing aids and cochlear implants. Cochlear implants components are external components, microphone, receiver, speech processor, antenna. Internal components, receiver, stimulator, electrode array. What are the benefits? Cochlear implants can improve the ability to understand speech and hear other sounds. They can provide a sense of sounds to people with severe to profound hearing loss. Note important here, it takes time and training to learn to hear the signals from the cochlear implant as words. So far we discussed about implantable hearing aids. We have done. Please subscribe our YouTube channel.